Hey everybody, this is Mark Newman from Precision Analytical, the makers of the Dutch test. I just wrapped up 4 videos showing you data that's pretty new to me and probably new to you and some of it brand new as you try to understand better what happens with transdermal hormones and testing. It's controversial within our market. Why is that? Because when you take a physiological or a normal dose of hormones, the increase you see in saliva, the increase you see in dried blood spot are a whole lot more than what you're going to see in serum or urine. And we got to unpack that and make sense of it. So we've been exploring that in that video series. What I want to do in this video is take a look at the peer-reviewed literature that's used to defend saliva testing for monitoring transdermal creams and gels. So again, saliva goes way up. Some people say this represents tissue. What studies do they use to quote unquote prove that? And what do we make of those studies? So we're going to look at those as charitably as we can, but it's important that we see them. So what studies are used to support saliva testing? And again, specifically with hormone creams and gels. Here's one of the most interesting studies that's used to discuss this. There's a lot here to learn. The question is, does it actually support the use of saliva testing to monitor topical progesterone? So what they do here, they took rats, they put topical progesterone on them, and then they went hunting for that progesterone. And where did they find it? So what you can see from the white bars here, that's where progesterone was. Lots of it in the uterus, lots of it in the lungs, and you can see there's a little bit in your blood plasma and a bit more than that in your saliva gland. So the point is made that saliva represents more of the progesterone than you see in urine or in plasma, or that would be the same as serum. So then the conclusion might be, okay, the saliva gland better represents the tissue that we see here. A couple problems with this. One, rats and humans don't absorb hormones all that similarly. So the skin of rats, guinea pigs, and rabbits is more permeable than that of humans. And if you want something more similar to humans, you want to look at something like pigs or monkeys. And you can see in this particular study, they looked at testosterone. There's your rat, there's your person. And interestingly, the serum data has always implied that testosterone absorbs at about 10%. The urine data implies the same for estrogen. It absorbs at about 10%, which this study implies is true of testosterone unless you put it on a rat, at which point you're going to get quite a bit more hormone. Now, this study was about progesterone. I haven't seen data like this about progesterone, but it's understood that the skin absorption of hormone is not really that similar between rats and people. So that's one thing to keep in mind. But also, the data itself is actually not analogous to what goes on in people. Because what people will say who study this is that when we put topical progesterone on, we get a lot of progesterone in saliva. So let's say saliva goes up maybe this high, if I'm just representing that. And then what we do is we measure it in urine, but you don't measure progesterone in urine ever. You measure the metabolites, right? And what we find in urine is that those metabolites really don't go anywhere. They stay really low. Well, in this study, here they are. Actually, more so than the saliva progesterone. That is not analogous to what happens in people. So this is an apples and oranges situation. So it doesn't really support any conclusion about what happens in people. The other thing that you'd see is if salivary progesterone is way up here in a human, what you'd see in plasma really wouldn't even register. Like this plasma being almost half of what's in saliva, that's not analogous at all to what goes on in people. In saliva, progesterone goes up 100-fold and more, and plasma barely bumps at all, right? So that's interesting. This is interesting in terms of what happens in rats, but it is by no means supportive of the fact that in a human, what's in the saliva is more reflective of what goes on in the uterus. Lastly, I would say this, which is saliva is about right here, right? The uterus is up here. So then if this was analogous, you would say this. If the saliva is flush with progesterone and this study represents people, the uterus is going to have gobs of progesterone, right? And we have to remember Rens study. In Rens study, they put on topical progesterone. This is the only study with endometrial biopsies and salivary progesterone values. And what they found is that the saliva went way up, but if you see here, they'll say it does not appear to be effective in inducing a secretory change in a proliferative endometrium. Translation, doesn't work. Even up to 64 milligrams, it doesn't work, right? And they said salivary progesterone levels were not of value in managing the therapy of postmenopausal women. Why? In this study, they know it didn't work, right? Let's look at patient number 5 here, okay? Patient 5 started off at 0.4 and then went up more than 100-fold, like 38 would be 100-fold increase. It's almost 1,000 times more hormone on average. The values bounced around between 100-fold increase and more than 1,000-fold increase. What does that tell you? It tells you if saliva is a tissue surrogate and if the uterus gets more progesterone than the saliva gland, these women probably have too much progesterone. Why didn't it work? Work because the saliva gland, yes, gets a lot of progesterone, but it is by no means been proven to be reflective of tissue in the unique situation when hormones are put on as a cream or a gel on the skin. Okay, so we need to be careful with the way we interpret it. All of these women had massive increases in their salivary progesterone. They bounced around all over the place. You can see, this woman went from 1.5 to over 1,000. So you test on a day, you're going to get a value somewhere in between there. Is it elevated? Yes. Does it matter clinically? The combination of these studies would say that it may not matter at all for any clinical outcome. Okay, that's number 1, the rat study. So the rat study is used commonly. The rat study is very interesting intellectually. It's very interesting academically. It doesn't prove anything about saliva being a useful monitoring tool to monitor topical progesterone in light of Rens study. Okay, this study, what they do? This study, they took topical estradiol and progesterone and they put it on and they said, wow, look at this. Placebo 0.6, progesterone 66, that's a 100-fold increase. Now, we're going to draw a parallel and say, when I put that dose of progesterone on, you know what happens in saliva? It goes up about 100-fold. That's a parallel. Therefore, so the conclusion is, therefore, saliva must represent tissue uptake, as we see here in breast tissue. It must work. What's the problem with that? Context. Context is key. If this progesterone was rubbed on the forearms, if this progesterone was put on the thigh, was put on the foot, was put on the neck, and it flooded the breast tissue at 100-fold, you could make a case that there's a parallel between what's going on there and what's going on in saliva. That's interesting, and that would be that would lean you intellectually in the direction of saying maybe saliva represents tissue well. The problem is, in this study, you can see the application is on the breast. So what have they proven here? What they've proven is that if you put a hormone close to a tissue, it's going to get flooded with that hormone. Now let me ask you, what lab value represents localized effect of testosterone? If I have a rash on my knee and I put a cortisol, a hydrocortisone cream or something on that rash, I'm trying to get localized impact, right? And it doesn't get very systemic. If I took that same hydrocortisone cream and rubbed it on my forearm to help the rash on my knee, it's not going to work very well, right? So we can't assume that this 100-fold increase they saw in the breast here is also in the uterus and the brain and elsewhere. The most logical interpretation here is that it's being put on tissue, it's absorbing locally. That's interesting. We can use that strategically. The fact that saliva happens to also go up 100-fold when it's put on wherever in the body, this is not evidence that saliva represents tissue. This is an interesting study. We learn from it, but it does not help us draw a conclusion that a saliva value represents breast tissue when hormones are put somewhere other than the breast, and the utility of the saliva values are not increased by looking at a study like this. Lastly, we look at a study. So I've just shown you two studies that I think don't lead you to conclude that saliva testing may have some clinical impact. Now, this study actually does nudge you in that direction. What did they do? So what Leonetti did is they put progesterone on women who are on estrogen, and they said, did it work? Do you get endometrial proliferation that is reduced? And they said placebo, there you go, which is the same as your baseline. And then look at that. We put on a little progesterone and that's lower. We put on more progesterone and it works. So here's what they said. They said, we did not see progesterone in the serum, okay? It appears to have systemic absorption. And they said, this might work. They said because of the short duration and the limited number of participants, we do not recommend this as an alternative to HRT until longer trials have been done. So this study legitimately points in the direction that says serum underestimates the clinical impact. So we should concede that. This leads into this critical question that we should be asking. Do clinical changes from transdermal progesterone or whatever hormone we're exploring exceed predictions made from changes in serum? And that study would say, yes, Leonetti, 2003, right? But we showed you the Rens study, right? Rens study said, no, it does not. And the most comprehensive study on this topic was done subsequent to that by Vashisht. And here is that study. You can read that study. The dose of natural progesterone cream in this study was insufficient to work, right? We would not recommend this combination of hormones to be used by postmenopausal women. So when people say, is there any evidence that saliva testing might better represent it? The Leonetti study did not include saliva testing, right? But it does imply that there's more clinical impact than you're seeing in serum. It's the only study that I've seen that legitimately nudges your brain in the direction of saying, hey, maybe saliva or maybe blood spot actually better represents the tissue level. But there are studies that contradict that, and especially Ren is pretty notable since Ren actually measured saliva values and said, you know what, they're not helpful at all. And this is not working in spite of the fact that salivary progesterone levels are elevated. And Vashisht confirmed that transdermal progesterone wasn't working well enough in that study to protect the endometrium. So as we engage this controversy, we want to be honest with all of the data and we want to seek out new data. I hope this has been helpful for you as you explore what lab testing makes the most sense, and it's going to be different. For topical progesterone, it's a different conclusion than topical testosterone, topical estrogen. Our opinion has been that with topical progesterone, it's not proven to work. You should be careful if you're trying to balance estrogen with it, and that no lab testing seems to provide useful feedback for monitoring the dosing. With estrogen, I think urine testing seems to reflect the best in terms of what's happening clinically and what's happening to the lab value and giving you a value that's stable over a 24-hour period. When it comes to testosterone, we believe serum to be king, that when you're looking at transdermal testosterone or really any testosterone therapy, serum seems to track really well with the clinical data. Now, if you want to know what's actually going on to create those elevated salivary values when people take creams and gels, you can watch the next video, which is going to be my best engagement in answering that question. If you have any questions on this or feedback or some interesting studies you think we should include in this analysis, please feel free to reach out, and we look forward to continuing this really interesting topic with all of you.